Have you ever felt like your mind and body weren't completely in sync? Have you ever felt anxious or depressed when you didn't even really have a reason to be? Well, as far back as 1880, doctors have known that there is a connection between the mind and the body through something known as the vagus nerve. So now let's get into what the vagus nerve is and how you can use vagus nerve stimulation to help relieve anxiety and depression. Hi, I'm Dr. Arianne Missimer. I am a functional medicine practitioner through the Institute of Functional Medicine. I'm a doctor of physical therapy and registered dietitian and the owner of the Movement Paradigm and Integrative Health Center. And I am super passionate about how the vagus nerve can have such a profound impact on our emotional, mental, and physical well-being. So what is the vagus nerve? The vagus nerve is actually a paired cranial nerve. So it is 80% of our parasympathetic nervous system. And think of it as a communication superhighway between our gut and our brain. So the anatomy of the vagus nerve really reveals so much. It exits our brainstem. It has branches into the ear, sensory branches. It has branches into the throat. It has branches all the way into the heart, the lungs, and the entire digestive tract. So what are some things that impact the vagus nerve? So of course, diet and our nutrition can have an influence on it. Things like any kind of gut dysregulation, so gut dysbiosis, leaky gut, parasite infections, stress and trauma, and even other types of viruses like COVID and any other infection. What happens when you have a healthy vagus nerve? So first, it is going to help with our speech and swallowing and optimizing our gag reflex, our acid production in our stomach. It's going to allow for proper gastric emptying. It can also help to regulate inflammation and influence psychiatric disorders such as anxiety and depression. It can also have a positive impact on blood sugar regulation. And lastly, it can influence our heart and our blood pressure regulation. So conversely, what happens when we have an unhealthy vagus nerve? So this can be referred to as vagal tone. So just like we are toning our muscles. So in this case, this can be associated with heart rate and blood pressure dysregulation. It can be associated with difficulty speaking, loss of a gag reflex, swallowing issues. And lastly, it can be associated with GI dysfunction, so inflammatory bowel disease, as well as irritable bowel syndrome. So now let's get into 5 ways that you can stimulate your vagus nerve, that you can help begin to regulate your nervous system. So why should you stimulate your vagus nerve? So as I mentioned, we want to think about increasing our vagal tone. We want to be thinking of improving our resiliency to life's stressors, whether that's a physical or emotional stressor. So our parasympathetic nervous system allows us to come back to that rest and digest state, that state of homeostasis, where we want to spend a lot of our time. Doesn't mean that the fight or flight is bad or freeze is bad occasionally, but we want to be able to regulate our nervous system. And the vagus nerve allows us to do that. It allows us to link all of these aspects of health together. So our gut and our immunity and our movement. So when we're thinking about doing this, there's lots of vagus nerve exercises. I'm going to share with you some of my favorites that I feel like are really helpful in improving vagal tone, allowing you to integrate these things into your daily life. And you can enjoy the shift of your nervous system state almost immediately. Number 1 is the salamander. So this is a version of Stanley Rosenberg's exercise. So you're going to start by interlacing your fingers like this, and you're going to bring them right behind the back of your head. From this position, you're going to keep your face forward and then just side bend your upper body. You're going to look with your eyes the opposite direction. So as you're doing that, you're going to hold that for approximately 30 seconds. Once you do that, you'll come back to center and repeat on the other side. So side bend your upper body, turn your eyes the opposite direction. Allow your shoulders to relax. There's no excess tension here. Even if one shoulder hurts, you can keep one hand on and take the other hand off. That's totally fine. Come back to center. And if you were able to, you can check your cervical range of motion, your neck range of motion before and after, and you should have an immediate improvement. And when you're doing that exercise, you are putting input via your hands and neurological input via your eyes to the occipital muscles and bringing blood flow to the brainstem. This is going to allow you to stimulate the vagus nerve, and because that is where the cranial nerves are exiting. And also you're stimulating the spinal accessory nerve that is influencing 2 neck muscles here. So this SCM muscle and the trap, which can create a relaxation of those muscles immediately. So you should feel either a sigh, a swallow, a yawn, a sign of relaxation of your nervous system, and potentially improved neck range of motion. Number 2 is an ear release. So this is not only a vagus nerve stimulation exercise, but it is also a craniosacral exercise. So when you're performing this exercise, you're going to start by using your fingers here, and you're going to grab the bottom of your earlobe. From here, you're going to gently pull your ear back and out. So if I'm facing towards you, I'm going to pull it back and out towards the back of my shoulder here. Very gently, again. And you're going to hold this here until you potentially have a sign of relaxation once again. So a sigh, swallow, or yawn, you feel a sense of calm. Any of these things can be responsive. Once you've done that, of course, you can repeat it on the other side. And then the second aspect to this exercise is you can come right under the ridge of your ear like this. So under this top ridge, and from here, just moving gentle circles slowly, and then repeating to the other side once again until you have potentially one of those responses. So we have branches in from the vagus nerve into the ear, and these are sensory branches. So you are actually stimulating the vagus nerve via the sensory branches that are feeding input to the brain. Number 3 is a myofascial technique. So this is where the vagus nerve is actually coming right under here. So a lot of times if we have any lymph congestion, for example, this can create a lot of inflammation around the vagus nerve. So even doing studies on post-COVID, that was one of the things that they found was there was inflammation around the vagus nerve using an ultrasound technique. So from here, what we're going to do is take 2 fingers. You're going to come behind your ear just a little bit. Okay, so right about here. And you're going to traction the tissue up and back. So I'm moving the skin. So I'll do it down here. I'm moving the skin over the tissue instead of just massaging it. Moving the skin over the tissue and just holding that position there. So I'm just, again, angling it up, holding that position. Already I'm noticing a swallow here. So that's my response. And once you have one of those responses, you can switch to the other side because the vagus nerve is also on the other side. And you can see if that has an influence on you. Number 4 is salivation. So as I mentioned that the vagus nerve has branches into the throat, so specifically the pharyngeal branch. And so when we are salivating, when we're able to actually generate enough saliva in our mouth, that's already in and of itself putting us in a parasympathetic state. So what I'm going to encourage you to do is try to think about generating saliva in your mouth. So you can think of a juicy lemon. You can think about pressing the tongue at the roof of your mouth. So you're going to keep thinking of this while I'm talking, keep thinking of generating the saliva. And then once you feel like you get some, and it might be hard, maybe really hard for some of you, once you feel like you get a little bit, just allow your tongue to just bathe in the saliva. And as you do this, you will almost immediately feel a swallow. Once again, that sign of relaxation. And so you can have that immediate response. It's a really easy one to incorporate throughout the day, anytime. No one would know what you're doing. And it's a great way to stimulate the vagus nerve. Number 5 is one of my favorites, is the abdominal massage. Lots of variations of the abdominal massage. But what I'd like you to think of here is you can do this lying down, which is a great alternative. But for the purpose of today, we'll do it seated. So placing one hand over the other and placing it right underneath of your rib cage here. We're going to start by just doing some gentle circles. So think of, again, if you can, doing it on the skin and moving the tissue just nice and easy, gently, not a lot of pressure. There shouldn't be any pain, in a smooth clockwise fashion. So as you're doing this, we want to think about 80% of the information from the vagus nerve is actually going to the brain. That's called afferent information. So when we are stimulating the vagus nerve via abdominal massage, we can have an impact on our brain. So how can you use these throughout your day to help with depression and anxiety? You can use these as a somatic approach, a physical approach to shifting your nervous system state. So for some of you, that might mean doing these exercises frequently throughout the day. For some of you, it might be before you go to bed or when you wake up or when you have a stressful event at work. So I encourage everyone to explore these, figure out when they feel best to you, which ones feel best for you, because everyone's nervous system is different. So explore them and see what is best for your body. If you want more videos like this to improve your health, make sure you like and follow to stay on the cutting edge of root cause medicine.